why would a woman not seek medical help?
Because she's told by her family members, her grandmother or her mother tells us कि ये तो होता रहता है, no? I mean, when you थोड़ा बहुत तो urine का leak will happen to you when you grow older.
In general also.
When you become menopausal, उसके time पर heavy bleeding तो normal है, ऐसा ही menopause होता है. See, there are so many myths which are surrounding them.
वेलकम टू परसेप्शन एंड बियॉन्ड. क्या आप जानते हैं कि विमेंस हेल्थ इशू सिर्फ फिजिकल नहीं होते, बल्कि उनके सेल्फ इमेज और सेल्फ कॉन्फिडेंस को भी डीपली इम्पैक्ट करते हैं. आज हम बात करने जा रहे हैं डॉक्टर अंशुमाला शुक्ला कुलकर्णी से, जो एक रिनाउंड गायनेकोलॉजिस्ट और रोबोटिक सर्जरी एक्सपर्ट है. वो हमें बताएंगे कैसे एडवांस सर्जिकल टेक्निक्स और अवेयरनेस के थ्रू हम इन हेल्थ चैलेंजेस को ओवरकम करके एक बेटर हेल्थ और सेल्फ एस्टीम बिल्ड कर सकते हैं. ये एपिसोड हर उस लेडी के लिए है जो अपनी हेल्थ और वेलबींग को प्रायोरिटी देना चाहते हैं. सो स्टे ट्यून्ड फॉर एन इंसाइटफुल कॉन्वर्सेशन. Hi doctor, welcome to Perception and Beyond.
Thank you.
Today we are touching on a very, very important subject, and that is women's health.
That's right. Yeah.
So my first question to you is that what are the biggest myths around reproductive organs and gynecological health of women that need to be debunked, according to you?
So, Suman, thank you so much, first of all, for highlighting on this very important and very crucial part of everybody's life, because a woman is pretty much the center of her home, and if she's not well and she's not there, the caregiver is not healthy, then you can't expect the care to be of top notch. So I think the whole scenario of how it has been so far is that women have always put themselves as being the last in terms of looking after their health, and any little issue which is there has always been given an excuse to say, so this used to happen to your mother, it's okay, or your grandmother's also gone through this. For example, heavy periods during your menopause. So it's just told that this is how menopause happens, and you have ladies walking in with a hemoglobin of 5, they've literally lost half of their blood in their body, but they've been told it's okay, like don't bother about it. Or for example, going in for a check for a teenage girl who's just started her periods. So this is natural, it's okay, you can go ahead and do it. But then this poor girl is having irregular periods and she's bleeding, and again her hemoglobin is falling down to 5, but again it's thought that it's all okay. So I think a woman should recognize that yes, you do have your reproductive health and it does have some ups and downs here. Maybe a little guidance is required, maybe some routine checkups are required just to keep yourself healthy. So this whole process of thinking that whatever women go through is just a part of the natural thing, it's unless it's like literally knocking on your door and really causing the water has just gone over you, is when you realize you need to go to the gynecologist. Should not be the way women should look at their health. So being on a regular touch, getting your regular checkups done, making sure that you are at least, especially like if your daughter is just started her periods, get her checked up, let her understand what she's going through, what's the right way to do it. I mean, there are so many things you can do to make her reproductive health very good. But there is someone who wants to get pregnant, so preconception, you make sure that you are right in terms of your health, and you are healthy enough to be able to hold a good healthy baby. So all of these things need to be put into our mindset for women to realize that they have to put themselves first if they have to be the best caregiver for their family.
I think the 4 stages in which mostly women come to a gynac is when there is an issue which is related with hormones, which is like your PCOS, PCOD, or somebody who wants to become pregnant, or somebody is already pregnant.
Correct.
Or somebody has excessive bleeding because they are menopausing. Other than that, people don't realize that there is a phenomena where you need to have a routine checkup.
Absolutely.
And you also need to take care of your overall health and well-being. So that is completely ignored till the time there is an alarm.
Absolutely.
That rings and people realize, "Arey, ab to doctor ke paas jana padega." So this is something which really needs to change in the mindset, because the priority is never given till you actually feel that, "Arey, now the red flag is on and now I need to really,
That's true.
connect with a doctor."
That's true.
So we have been talking about different kind of things, and one most important thing which is now highlighted everywhere and people are talking about is the advanced methods of surgeries like the robotic surgery, because people also, women especially, also have this apprehension that बहुत लंबा procedure होगा if I have to get operated, if there is a surgery, and then there is, post-surgery care and all those kind of things. So how is robotic surgery bringing that downtime or reducing that downtime, and how is it beneficial for overall health?
Correct. So, like I said, women are going to be the center of caregiving, and if they are not up and about back to their routine activities quick enough, it's going to affect everybody in the family. So, robot-assisted surgery was started with us in 2012 at Kokilaben Dhirubhai Ambani Hospital, where I'm at. And we basically, that whole process was started as a modernization, or let's say applying AI to laparoscopy or minimal access surgery. So minimal access surgery basically by word itself means that there are very small incisions, but you're able to do the complete job inside without actually making a huge traditional big cut of 12 centimeters, 15 centimeters. Now there were some constraints in terms of how the camera would look or how the instruments would be, which would give sometimes a very skilled person would be able to do it, or it would be sometimes impossible to do it with laparoscopy. So that's where robotics stepped in. So you had this application of AI and computers to laparoscopy. So now you had three-dimensional vision, which is immersive. So you're looking in, like I'm good sitting in the console. When I look inside, it's like I'm looking straight into the patient's abdomen. So I'm literally right next to the uterus, right next to the ovary. I'm able to in detail look at everything very well. Plus, it is a three-dimensional issue, so I'm not losing my depth perception. So my surgery is much faster that way. And the instruments is the best thing about it, is the instruments have got a hand-like motion like this. So they literally move like my hand is moving inside. So it's essentially a translation of open surgery where you see in 3D and you operate with your hands, but doing it through minimal access. So you don't make a big cut, and through small incisions, you're able to do the entire surgery. And then robotics has evolved itself to, have a lot of intelligent other features, like having NIR. It's a filter which allows us to look at a green dye called IC gene. Very, very crucial if you're doing a very complex uterus removal surgery. You want to see the ureter. It's the most key part of the pelvis, and it should not be damaged because there's implications to the kidney and things like that. Right. So you can see that very well. You can use ultrasounds during robotic surgery. So if I have a fibroid which is located in a very difficult access place and I'm not able to see it, and I'm not sure, and obviously I do not want to leave it behind, I can use an ultrasound while I'm doing the surgery. So I can do the ultrasound on the table and see the uterus in front like that, and then the ultrasound image right below, and correlate the two. So you can actually, map this very well. So endo ultrasound is possible. It's also possible to recreate 3D images of your MRI. Say you have a very complex fibroid surgery, and you have multiple fibroids here and there. You have a 3D image of MRI which is created and can be superimposed on the actual uterus. So while I'm doing the surgery, it's like a guidance I'm getting to say, okay, this is where this fibroid is, this is where this fibroid is, this is where I should make my cut. So it's basically simplifying how you approach the uterus. It helps to improve efficacy and specificity. Your precision of surgery is much better. And all of this is done through small incisions. So, you literally have 3 small or 4 small incisions, which are 1 stitch only, 8 millimeters. So the patient is sitting up the next day in the bed and says, "Doctor, did you actually operate on me?"
Yeah.
That's the thing I get to hear from them. So it's like, yeah, because you have no pain, you don't bleed so much, and your recovery is really fast. So it has changed the way surgery perception for women should be and how well they recover. Also in long-term, pain related to having big scars, adhesions inside, which can cause damage to other organs. All those things are much lesser with the help of robotic surgery. So it has changed a lot of things. Even in cancer surgery, it has improved how you look at lymph nodes, how well you clear your lymph nodes. You don't have to make really big incisions to go up to para-aortic lymph nodes or things like that. So the whole way of the ease of the surgery has increased, as well as your specificity has increased. That's what robotics has done to minimal access surgery.
So which means that there is less risk involved as compared to a regular surgery, because contrary to popular belief, people feel that अरे robot कुछ करेगा तो पता नहीं क्या होगा, that kind of a feeling. So I think this is less risky.
Yeah.
and the downtime is also reduced.
Absolutely. And so far, thank God, there are no robots who can do the surgeon's work yet. So we are not there yet. We don't have any automated robots who can be programmed to do anything. The name is given because I'm seated at a console which is a few maybe feet away from where the patient and the entire console of the robot is. And I'm controlling it on a device called the console, which is a surgeon's console. So it's just that because there is a distance, it's called robotics. But the robot on its own will not do anything. It is not automated in any way at all. So it just enhances my surgery. That's about it. So, you don't have to worry that the robot would suddenly do something and, like those sci-fi movies where the robot went really crazy and cut everything up inside. No, that's not happening.
Yeah.
Yeah.
Wonderful. So how does the biological clock really work when it comes to fertility? And what are the factors that influence ovarian health and aging?
So, this is a very important question to ask for considering how our generation is going. Believe me, because our egg counts, or let's say the egg reserve that we are born with, when we are born with maybe about 450,000, 500,000 eggs in our ovaries. So the ovaries technically were there inside of you with all of its egg when you came out of your mom's womb. Each of them will mature and start releasing every month when you start your periods. Now, the depletion or decline of these eggs was traditionally entirely dependent on age and your genetics. So if you were born with more eggs, obviously you lasted longer and you could have your periods till 55. If you did not, you would have an early menopause at 45. So it was a lot of genetics involved in it. But now, currently, the way I see how patients are coming in with polycystic ovaries, or they have coming in with maybe having had a previous laparoscopic surgery, or even people who are stressed out, who are exposed to a lot of environmental pollution, we are seeing egg counts reducing rapidly in these people. There are also certain studies where they found certain gene mutations in patients, which has led to a less egg count even at a very young age, surprisingly. So now we see a lot of 30-year-olds actually struggling with low egg counts now as compared to what it was maybe 10 years down the line, right? So natural aging, and what we used to traditionally tell people was, you should finish your childbearing by the time you're 35, because traditionally that is when your actual egg count starts reducing and you start losing the good egg balance in your ovary, and after 40 it's like a really steep fall. But now what we are seeing is even at 30, patients are having very less egg count. So my advice would be to say that you will generally follow your genetics, but eat right, eat healthy. Try not to have too much of processed things, be away from as much of pollution as you can. And, if you have not got married by the time you're 30, or you don't know what your future is going to be, you're married, but you don't know if you want to have children by then or not, then at least get yourself checked to see what your fertility count is. And if it is on the lower side, consider egg preservation, egg oocyte conservation, because we are seeing more and more people by the time they're 35, suddenly coming in with a shock to say that their AMH levels are very, very low. So, it comes back to the same thing. Get yourself checked, even if you have no problem, because things have changed now, our environment has changed now, and, your reproduction is changing accordingly.
So when you said about egg preservation, how does that happen? Because a lot of people still are not aware of it.
Correct.
So what is the process if one needs to actually go about?
It's like an assisted reproduction. Basically, you're mimicking what happens to you every month with your period cycle, where you release one egg. But here we are giving maybe 4 or 5 times the dosage of the same hormones to your system by giving you an external injection, so that you produce more than one egg. So you produce 10 or 12 eggs or so. And once they are monitored and they're ripe, we just put you under a small anesthesia, and with the needle we just take the eggs out and we freeze them. Okay. And once we've frozen them, they can stay there for about up to 10 years of time, and you can, whenever you need to use them, you can have them out, make an embryo and have it implanted inside your uterus. So the whole process of egg freezing, I would say about 15 days time it would take, and it would involve a short anesthesia and a short procedure as well, and hormone injections. That's how it happens.
And where do you freeze these eggs?
So the eggs of a lot of centers around Mumbai that do that. I mean, most of fertility centers will offer an egg freezing process for you. And so you can do that at any of those centers. Yeah.
Wonderful.
Cool.
We have been hearing a lot about ovarian cancer. So what is actually ovarian cancer, and how does it become a silent killer? And what does one do to prevent it?
So ovarian cancer is very much dependent on your genetics. So if you have a family history of ovarian cancer, breast cancer or uterine cancer, your risk is certainly more than anyone else who's there. And we cannot pinpoint to say what is the exact reason, but some people who have these epithelial tumors, which are tumors which grow from the surface of the ovary, like a serous cyst adenoma or a mucinous cyst adenoma, they have a tendency of developing cancer later. And very old endometrioma, ovarian endometrioma or an endometriosis cyst also has a tendency of becoming malignancy later. So your risk factors essentially would be someone who's not had children. Pregnancies, you increase your risk. If you're obese, you increase your risk. If you have a genetic factor, you increase your risk. If you've had any of these serous cyst adenomas in your ovary, you can develop malignancy in that over there. Also, IVF, if you're going through in IVF procedures, it would increase your risk, but it's not too much. But if you've undergone multiple, then yes, your risk can increase slightly. And the reason why it's called a silent killer is because most often these cysts will form after you've become menopausal, most commonly. Yeah.
Okay.
So they are after 55 years of age, and when they are growing slow, they don't have any symptoms. You don't get periods or any irregularity or anything like that. They just grow silently. And at the most, you might feel bloating or an uneasy sensation in your abdomen and nothing else. And most ovarian cancers are diagnosed when you're already reached a stage 3, which means it has got more than local spread. That's the reason why it's called a silent killer, because there are no major signs or symptoms to tell you you've developed ovarian cancer. So the only way to beat this is to ensure that you are under regular surveillance. So you are on medications and you are getting yourself checked up with an ultrasound, to make sure that your ovaries are healthy. That's the way to do it.
Is there any way to detect, little earlier? Is it only through the regular checkups, or is there anything else that one
blood
can
reports can be done. There are certain tumor markers which are offered. Most of your comprehensive health packages which people go through would have cancer markers being included in the package. So those cancer markers can also give you an alarm earlier on to tell you that maybe there is something on. Genetic testing generally is advisable only if you've had a very strong history in the family of cancers. That's when you do your genetic testing to see if you're prone to developing ovarian cancer. So then your surveillance becomes that much more rigid. Other than that, it's just regular ultrasounds. Yeah.
Okay, that's quite a scary situation to be in. But then yes, for everything, I think an early intervention or a regular checkup is something which is very, very important.
Yes.
In any case, I think
Absolutely.
just a routine checkup to take care of everything, so that you don't reach a stage where it is too late for you to even do anything about it.
That's true. That's true.
So doctor, what is endometriosis? I think this is your area of specialization, and what happens? How are people not understanding what this entire thing is all about?
So, you said silent killer for ovarian cancers. Endometriosis is a silent epidemic.
Okay.
Now, the reason why the word silent is tagged to endometriosis is because it is not diagnosed for the longest time. So, if a patient, a young girl or a 20-year-old is having pain in her period cycle, the most common thing told to her is that this is just normal. Everyone who has period pain, everyone has period pain. So, what's the big deal? And, you're just making too much about it. And the problem also is compounded by the fact that you have the symptoms, but you do the ultrasound and nothing shows up. So, if you do a regular ultrasound and you go to your doctor or a gynecologist, and they may do an ultrasound, they may do a blood test, but they will not show up anything. But still, you are doubling up in pain and you are requiring IV painkillers. But you're dismissed to say, okay, this is just normal. It'll get better when you get older and things like that. So endometriosis is a silent epidemic simply because it doesn't get recognized earlier. And what it exactly is there are these lesions growing around the uterus, which is similar to the uterus lining. Now, these lesions grow in different areas around the uterus, pelvis, organs. They respond to the hormones that your ovary is producing. So every month with period cycle, they will blow up, they will become inflamed, and they will cause immense amount of pain. They can go and stick to different organs around your system. So they can go and stick to the urine bladder, to the intestine, to the ovaries, to the nerves which are there in the pelvic area. Sometimes they travel all the way up to the lungs. So they can cause, and the thing about it is that the symptoms are always matching with your period cycle, because they respond to hormones too. So they get inflamed, they cause pain and they cause adhesion simply because they are increasing in size exactly with your period cycle. You will get a lot of pain, and suddenly in the between 10 days you're absolutely fine, and the pain just comes back again to you. So endometriosis is this condition which also has a lot of other issues in the body as well. So it's a chronic inflammatory disease. So it's causing inflammation and swelling, and it's something which is ongoing for a long, long period of time. That's what chronic is all about. So the way to diagnose endometriosis is, first of all, to get a very good history. So when you go into a gynecologist or an endometriosis expert, taking a very detailed history to figure out what your symptoms are, whether, sometimes endometriosis patients will land up going to the gastroenterologist because endometriosis will cause IBS-like symptoms. It will cause you frequency of passing stools, pain while passing stools, and sometimes constipation, sometimes diarrhea. And patient, very often, in fact, I had a patient who had modified her entire diet to adjust for the endometriosis which was growing on her intestines. But she did not realize that her painful periods was related to this bloating sensation she would get, or she could not tolerate so many foods, and she didn't realize any of that stuff. She came to me because she wanted to get pregnant. And when we investigated her, we found out she had endometriosis. She was taking treatment for IBS all this while. Okay, and on our investigations, we found out she had her adenomyoma in the uterus, she had ovarian cyst, and then she had a huge 3-centimeter nodule in the intestine. That was blocking her ability of passing stools and giving her so much bloating that she thought it's her diet. So she had adjusted everything around her. She lost 10, 12 kilos because she just stopped eating things, because she thought that's the way to take care of it. She didn't realize that this could mean, and probably well-meaningly, she meant people who probably didn't realize either, doctors didn't realize either, that she was actually having something else. And the best part of it is we do the surgery, we remove that bowel part which was there, we remove the endometriosis, uterus she wanted to keep because she wanted to get pregnant, and suddenly all those symptoms vanished. So now she's able to eat normally, she gains her weight back, she starts feeling better all the way, and she comes and tells me, I really didn't realize that I had changed my life to adjust to this, simply because she had not been diagnosed, she was never told.
Correct.
So that's the thing with endometriosis. There are so many such symptoms that will come to you, but unless you have taken a good history and you got yourself diagnosed correctly, blood test, there are some genetic testing which is done for it. There is a salivary RNA which is done to check for presence of endometriosis now, but ultrasound, MRI are the two methods of checking, and then the last comes laparoscopy, where you actually look at these things and figure out that you have endometriosis.
So doc, for example, if I have endometriosis, now what do I do about it? How do I maintain or manage or take care of it? Because I really don't know how to go about it.
Correct. So the first thing is, congratulations, you've got yourself diagnosed with endometriosis, because that is something that's a challenge for most women. 4 to 7 years around there, right? Now, we call it endometriosis life, from your diagnosis till the time, say, you're menopausal, because generally post-menopause, because there are no hormones, you don't have symptoms of endometriosis still persisting so much, right? There is a very few percentage of people, even after menopause, who will have endometriosis, which will keep coming back, but generally it is not the case. So you look at yourself as a 25-year-old who is diagnosed with endometriosis, and you have like next 25 years to manage yourself in terms of your symptoms and medications and things that are required. So we always look at it to say we should treat the patient and not the disease, okay? So the advice I would give my patients is like, what is your goal in life? Is it going to be pain management? Is it fertility? Depending on that, we have your treatment. What is your stage of endometriosis that is present, whether you are at a stage 1, stage 2, stage 3, stage 4. Of course, stage 3, stage 4 requires surgery first, but otherwise there's medical management available. So that's how we manage it. And when we say endometriosis life, we say in those 25 years, let's keep our surgeries to the minimum, because often endometriosis patients land up with having multiple surgeries because they do one and it comes back because it comes back. We have no cure for endometriosis. So you want to manage yourself in such a way that you say you do a surgery for a particular goal of pain relief or fertility, and you manage yourself with medications after that. And maybe at the end, it may require a second surgery, but that should be a definitive surgery where everything is looked after and taken care of, right? Everything, uterus, ovary, everything is removed. As a patient, what you can do is to keep your diet in check. So there is a lot of research which says that taking anti-inflammatory diet really helps. to reduce inflammation, because like I said, it's a chronic inflammatory disease. Your body's immune system is really overreacting, and because of that there are a lot of say arthritis, allergies, skin changes, bloating, digestive issues, all kinds of things can happen to you. So keeping your diet in check to have all kinds of anti-inflammatory food which are high in fiber, of things like avocado, olives, fish, flax seeds, walnuts, really help to keep the inflammation down. Avoid refined sugar, refined flour, and a lot of dairy products in a lot of patients are not very good. Also maintaining a very good physical health. So, exercise has tremendous benefits for everything else also, but for this as well, in terms of reducing inflammation. And often patients who have endometriosis, when they encounter the word endometriosis, right, so they get very anxious. And also a lot of times, because they've had these symptoms for so long before they get that validation to say, okay, your pain is coming from here, you're not crazy, there is a problem here and we will treat it. That sense of relief that they get when they realize, okay, I'm diagnosed and it's not just, I was just not making it up, I am actually going through pain. They often have a lot of anxiety. They have a lot of depression as well. So exercise has those benefits. It's going to take away that anxiety, take away the depression, make you feel good about yourself, reducing inflammation, keeping your weight under check. These are the things as a patient you can do in accordance to whatever else the doctor is doing for your endometriosis to look after yourself. And also I feel each endometriosis patient, though they go through their own journey, must as far as possible try and talk to more people about it, because people still don't know. Even the word endometriosis, to say for some people, it's like, what is this? I mean, what are you talking about? So anybody who has it, I would say as a patient, I always tell them, like, look, go and look around in your family. Is there anybody else? Because it runs in families too. So if you have it, you have a 1 in 7 chance of passing it on to your first degree relatives. Go and talk around to people in your family as well. Figure out if there's anyone else who's actually hiding this symptom and not talking about it. So mothers will come in with their daughters, and I've seen this. There a mother comes in with her daughter and she says she has endometriosis. I said, why are you saying that? And she's like, because I have gone through it and I had to fight my entire family to actually go ahead and seek help and get my surgery done, because nobody would believe me that I have a problem. And I knew I had a problem, and I can see the same thing in her. So now I have dragged her in and I said, now you have to diagnose her and treat her, because I know she has this problem. So I said, kudos to you, because she took that step for herself. She was vocal and she went ahead and, got herself treated and now is getting her daughter. So the same thing with all endometriosis patients. Like, go around, look around in your family. Talk to them and ask them, look, maybe you may be having something like this. Go ahead and, pass the, let's say, what is that called? Pass the favor? Or is that something like that? Yeah, that's what you should be doing.
Absolutely.
Yeah.
So, which means that anybody who has endometriosis, can they lead a normal life with diet and proper self-care?
So these are complementary to whatever else is required for endo. By itself, you cannot prevent endometriosis. So by itself, just being on a very good diet and a good exercise regimen is not going to take away the problem of endometriosis invading your intestines or invading your nerves or causing a damage to the eggs in your ovaries or your fallopian tubes. No, diet and exercise is not going to take that away. But whatever your gynecologist is prescribing to you in terms of medications or surgery, if you complement that with your diet exercise, then you win it. You can actually be absolutely normal because you're taking care of yourself in that way.
So is it as good as, like, you have diabetes and you're managing diabetes the same way you're managing your endometriosis?
That's true. So you have to take your medications and you have to do whatever else is required. That's right.
Can you throw some light on PCOS? Because that's also another area where
Correct.
a lot of younger women fall trap and then they don't know what to do about it, and
Correct.
that also impacts their self-confidence to a large extent.
Very much so. So PCOD is another epidemic amongst younger girls. So adolescents who just started their period cycle, about 20 years of age or so. I think that's all thanks to the diet and the environment that we're living in right now, that they are exposed to this and then they develop all of these things. Here again, genetics does come into play. So if you have a family tendency developing PCOS, you can develop PCOS as well. For these people, that's where I would say, when a girl starts her period cycle, getting her in for a check and advice would be a very good idea, because For them, when they are starting their menstrual cycle, just to keep a tab on it, be regular with it, do your exercise regularly, keep your diet under control is very, very important, because PCOS has 3 things central to taking care of it. So in your lifestyle, what kind of diet you eat, how much of processed food you're consuming, what kind of exercise you're doing, is your life very sedentary or are you at least moderately active, and how much of stress you take. These always are the 3 central things in PCOS which actually keep increasing your symptoms. So maybe you require some medications to regulate your periods initially, because PCOS essentially means you don't release an egg every month like you should. So because you're not releasing an egg every month, you don't get your periods regularly, there is irregularity in your period cycle, and then that makes your male hormone level go very high, so you have excess amount of hair growth, you have hair fall, you have gained weight, and then the weight further compounds the whole problem once again. So it's like a big cycle that keeps happening.
Correct.
So that's where PCOS, you require medications initially to get your symptoms in control, to help you lose weight. But essentially, taking care of your lifestyle in terms of diet, exercise, and stress is what is in the long term going to help you to keep your PCOS under control.
I think every second girl or a woman that I speak with,
Correct.
they are either undergoing something to do with their uterus health or their skin health or their weight issues, because they have PCOD, PCOS, and this has become such a common phenomenon. I think a lot of contribution to these kind of issues is largely the pollution, the environment, the kind of food that we eat, the kind of lifestyle that we lead. I think all these play a big role, plus the amount of, like you said, the stress levels. So all these factors contribute to a great extent when it comes to our health. And our health is not really taken care. It is largely ignored till the time there are, like I said, those
red flags,
red flags which flash when there is weight gain, or when you see some chin hair, and then there are acne all around the face. All these things, all these symptoms, when they crop up, that is when we realize, "Arey, chalo, doctor ke paas jana," and to see that what is happening and what is contributing to these kind of issues. So I think there's a lot of pressure on all of us, because we don't prioritize ourselves, to be very honest. Unless and until we realize that, okay, abhi to life and death wali situation aa gayi hai, we don't really prioritize ourselves.
That's true. And not to scare anybody to say that, this can happen to you, this can happen to you. There are so many problems in women and all of it. Yeah, I mean, there are problems there, but I think central to all of this is that going back to what our roots were. So this whole fad that we had of eating processed food and jhatpat cheeze which you can just quickly eat, and just not exercising enough. I mean, considering the amount of commute women have to do in Mumbai to travel to their workplace and things like that, they don't have the time. So, being innovative and making sure that you use your time to do some exercise in between. Your diet also, if you can make sure that your dabba is actually a very good and healthy dabba, not resorting to eating something outside. These minor things you can do, and consciously realize that, overuse of plastic, overuse of preservatives, all of these things can be avoided in your routine diet. I think if we go back there, then we may not be in such an alarming situation in the future.
Certainly. So, Doc, what is menopause? And how does it impact our self-esteem and confidence level?
So menopause is the other transition. So you start off with, getting your periods and your menarche, as we call it, which is again a very big event for a woman or a girl to change into a woman, and all of those changes that are associated with it. Goes on well for about maybe 30 years, after which is maybe 30 plus years, after which you start entering the phase where now your reproductive age is getting over. So menopause essentially means not having periods for a year. Okay. And why do you get into menopause? Is because, like I said initially, you are born with a certain number of eggs, and you do run out of them at a certain period of time. You cannot produce eggs. It's not possible. You cannot have them replicate themselves. So you will run out of them. When you run out of them, you run out of the main hormone that makes you a female, which is the estrogen. Now, estrogen is important for a woman for a lot of things, whether it is maintaining the skin and hair texture, whether it's maintaining her weight, whether it's maintaining the balance of, the bone health, your cartilage health, your mental health also. So your well-being in terms of being in control, being able to do work, being able to concentrate, memorize, All of those things are all dependent on estrogen. And when estrogen starts stepping out of your body, there are a lot of issues that women go through. There is a phase before menopause hits you called perimenopause, where there are a lot of ups and downs of your hormones initially. So your periods are not very regular at that point of time. And whenever there are no periods, you suddenly feel very bloated. You have hot flashes, you have irritability, you have mood swings, you may gain a lot of weight. And then the period comes and you feel normal again. So these ups and downs keep happening. So it's a natural transition that women go through. But a lot of women have a lot of problems that are created because of it. I think one of the most important things that I feel a woman should address is when you're getting into perimenopause and you have these mood swings and you have a lot of emotional turmoil and you feel very helpless, to say so to speak, because you don't remember things that you're supposed to do. Getting your family members around you, understanding that is very important. Very typical situation where I would see a husband and a daughter come in with a mother, and the mother is like, I feel this, I feel that, and they're all like, I don't know what is wrong with her, she just keeps shouting at us. And then the mother would just start crying right there. And these guys are like, she's gone crazy. Why is she behaving in this manner? So educating the family to understand that a woman is going through this change, and now she was this super mom who did so much for you right now. Maybe now she gets tired. Maybe now she just wants her me time. She just does not want to do it. You rally around her and do that for her, and don't chide her or tell her that, oh, you're not able to do this, oh, you're not able to do that, or why can't you remember this, or why are you getting so emotional? Be patient with her, because this is a change that is very, very, it's very, very real. It happens to women. Unfortunately, we don't realize it. We don't educate them. So it's not like if a family will not help you, but they're not educated enough to understand that the woman is going through this. So that the emotional issue or the mental health issue the woman goes through, it's possible to get over it. It's a phase. It goes away after some time. I think educating the family around them, educating the woman that what she's going through really helps for them.
And I think to a great extent, even awareness about this has become more prominent.
Correct.
Because a lot of people have started talking about perimenopausal phase, and I don't think that this causes any kind of a hesitation or an embarrassment, because earlier people used to think that periods band ho raha hai to iske bare mein baat nahi karni hai. But now I think everybody is very open about the fact that, okay, fine, I am going through a certain phase in life, and this is a very natural phenomenon.
Correct.
So there's nothing to hide about it.
No.
So I am going through the same phase right now, and I very openly talk about it. I have come to you and I've discussed very openly about certain things.
True.
And it not only impacts you as an individual, it also impacts your relationship with your spouse, with your family, because, there are so many things that factor in. When you're menopausing or when you're in the phase of the menopausal stage. It's not easy to deal with it.
No.
Everybody understands, and everybody must understand if they don't. That what a woman goes through at that point of time, and it is so important that if she is not able to take care of herself, to actually bring her to the right doctor and get herself treated. What are the right kind of multivitamins or supplements, the supplements which are required at that point of time. You must take care of all these things. These are small things, and at some point a woman would expect that the family should
do something,
come together and do something about it, take action.
Absolutely.
And there are so many women who would not even say or would not be vocal about it. I'm a very vocal person, but there are so many people who are not vocal because they're not confident enough. Or they feel that, okay, this is something which is like a taboo topic. I don't want to talk about it. But at the same time, if people are not aware, there could be so many issues, so many illnesses that could be associated with it.
Absolutely.
And I think that is why awareness in the family is very, very important. And there should not be any kind of a hesitation in having an open talk about these kind of issues. Be it periods, be it menopause, be it hormonal issues. I think there has to be a very open conversation and a clear communication in the family about it.
So yeah, I mean, earlier on talking about women or women's periods or health was not something that people would discuss. I mean, you would not want to. Nobody would.
A father would not talk to a daughter
the doctor.
about.
Absolutely, yeah.
That was such a strange thing. Today, everybody talks about it. My father never spoke to me about my periods.
No.
Today, my daughter speaks to my father about her periods very comfortably.
True.
So the time has changed, and people have started realizing that ये सब normal है. I mean, let's make things normal in the family.
Yeah, that is very essential that we do that, because that's where at least women will start getting heard and feel that they can handle and deal with this rather than so that's why I see counseling the whole family when a woman is coming in. It's very important. Just the woman by herself coming in, but she may understand it, whether she can relate to the family as well. I think this conversation we are having, if it reaches people and they are able to start that conversation at home, it will be a very big step.
Have you had any kind of a case study where you had to counsel a husband because the wife was going through menopause?
Yeah, absolutely. I had to do it all the time. I mean, the conversation generally goes with like, I have to go through her mood swings, and I have to still listen to her doing this and that. So I said, like, she's taken care of you for so many years. Yeah, you hold her hand for a year, give her that space. It's fine. Like, you can do it for her. She's done it for you for so many years that you've been married to her. So why don't you give her that space for that 1 year that she's going through this phase? She'll get back to normal, and you will probably find a new passion for cooking maybe, or perhaps or tidying up at home. So, try out something new for yourself. Absolutely. I think that it's a conversation that's very, very important to have.
But then when it comes to menopause or perimenopausal phase, for how long does it continue, or for how long does it last?
It's very variable. So there are some women who would go through it like nothing's happened. They would not feel anything. But there are some who go through this phase of perimenopause, which starts off maybe 2-3 years in advance to actually hitting menopause. And then the whole phase of getting used to the menopause itself takes another year or so. So it's very variable, but I would say maybe 2 to 3 years is the average that you would actually go through this entire phase of change in your body system.
I've gone through it for 7 years.
7 years, wow.
7 years, 7 long years, and it's been tough.
Yeah, I know.
It's been really tough.
Yeah.
डॉग एक बहुत ही इम्पॉर्टेंट टॉपिक है हिस्टेरेक्टमी, जिसके बारे में लोगों को अभी तक बहुत ज़्यादा अवेयरनेस नहीं है, और ये एक बहुत बड़ा टैबू भी है कई फैमिलीज में, इंक्लूडिंग माय फैमिली, क्योंकि अभी हम लोग फैमिली मेम्बर में एक किसी के साथ में बात कर रहे हैं दैट यू नीड टू गेट हिस्टेरेक्टमी डन, और एक माइंडसेट यहाँ पे ये भी आ रहा है कि ये मुझे नहीं कराना है क्योंकि ये सब तो तभी ज़रूरत है जब बहुत ही कंडीशन ख़राब हो जाती है बॉडी में. सो व्हाट इज़ योर माइंडसेट? हिस्टेरेक्टमी क्या है और कब ज़रूरत पड़ती है?
सो हिस्टेरेक्टमी बेसिकली जो गर्भाशय होती है, बच्चेदानी जिसको बोलते हैं, उसको निकालना होता है, यूट्रस. सो बेसिकली हम सर्जरी तभी करेंगे जब वो पर्टिकुलर ऑर्गन आपकी बॉडी को हार्म कर रहा है, ज़्यादा तकलीफ दे रहा है एज़ कम्पेयर टू उसमें कोई बेनिफिट आ रहा है. ठीक है, या तो आपको प्रेगनेंसी चाहिए या यू वांट टू गेट प्रेग्नेंट, तो हम यूट्रस रखें. पर अगर यूट्रस में फाइब्रॉइड्स हैं या उसमें कोई ऐसी सूजन है जिससे की वजह से आपकी ब्लीडिंग इतनी ज़्यादा हो रही है कि आपका हीमोग्लोबिन ख़राब हो रहा है, 9 जा रहा है, 10 जा रहा है, 8 जा रहा है, आपको ब्लड ट्रांसफ्यूजन लेने की ज़रूरत पड़ रही है, आपको इंजेक्शन लेने की ज़रूरत पड़ रही है, या फिर यूट्रस में ऐसा कोई कंडीशन है जिसको बोलते हैं एडिनोमायोसिस, जिसमें इतनी सूजन हो रही है कि आपको पीरियड के साथ साथ पेन भी, दर्द भी बहुत ज़्यादा हो रहा है, तो आपको पेन किलर लेने की ज़रूरत पड़ रही है. सो एक डिजीज़्ड ऑर्गन जो अपना काम कर चुका है या जिसकी ज़रूरत नहीं है और जिसकी वजह से आपके बाकी के ऑर्गन्स पे फ़र्क पड़ रहा है. जैसे हम कहते हैं कि पीरियड जब बंद होने का समय आ जाता है तो पीरियड हैवी ब्लीडिंग ही होती है, बट ऐसा ज़रूरी नहीं है. हैवी ब्लीडिंग इज़ नॉट नॉर्मल कि आपको पीरियड जब बंद होने वाला होता है तो पीरियड एकदम हैवी हो जाना चाहिए. वो हैवी ब्लीडिंग कभी कभार एक प्री कैंसरस लीजन का एक साइन होता है, और अगर हम उसको डायग्नोस नहीं करते, उसको ट्रीट नहीं करते हैं, तो एक 5-6 साल में आपको कैंसर हो सकता है उसमें. तो इस तरीके से अगर यूट्रस आपको तकलीफ़ दे रहा है और आपकी एज एक पर्टिकुलर एज के ऊपर हो चुकी है जिसमें आपको प्रेगनेंसी नहीं चाहिए, और हमारा कोई और मेडिकल ट्रीटमेंट नहीं काम कर रहा है इस चीज़ पर, तो डेफिनेटली उसको यूट्रस को निकालने की ज़रूरत पड़ती ही है. क्योंकि आपकी बाकी के और वाइटल ऑर्गन्स को तो आप डैमेज नहीं कर सकते, जैसे किडनीज़ को पेन किलर लेकर या हार्ट को स्ट्रेन देकर, क्योंकि आपका हीमोग्लोबिन इतना कम हो रहा है. सो यू हैव टू वे द बैलेंस कि क्या प्रॉब्लम है और इसका सोल्यूशन क्या है. अगर प्रॉब्लम इतना बड़ा हो चुका है कि इसमें दवाइयों वाला सोल्यूशन नहीं काम करेगा तो नेचुरली यूट्रस निकालने की ज़रूरत पड़ जाती है. अब यूट्रस निकालना और साइड इफ़ेक्ट्स होना ये दो डिफरेंट चीज़ें हैं. बहुत बार हम ये समझते हैं कि बच्चेदानी निकाल रहे हैं, यूट्रस निकाल रहे हैं, इसका मतलब है यूट्रस निकालने पे हमारा मेनोपॉज हो गया है, पीरियड पूरी तरह से बंद हो गए और हमें बहुत सारे साइड इफ़ेक्ट होंगे. आंखें कमज़ोर हो जाएंगी, वज़न बढ़ जाएगा, ब्लड प्रेशर हो जाएगा, हड्डी कमज़ोर हो जाएगी, दर्द होने लग जाएगा, डिप्रेशन होगा, ये सब. तो यूट्रस केवल पीरियड्स देता है, आपको दिखाता है पीरियड्स की ब्लीडिंग, और आपके जो प्रेगनेंसी होती है उसको बच्चे को बढ़ने के लिए जो जगह होती है वो होता है यूट्रस. बट यूट्रस अपने आप से कोई काम नहीं करता. ओके, द मेन ऑर्गन होता है ओवरी, जो आपके यूट्रस के बगल में होती है, बीज कोश या ओवरी बोलते हैं जिसको, जिसमें से अंडे बाहर आते हैं हर महीने, और उसका जो हार्मोन होता है ईस्ट्रोजन प्रोजेस्टेरॉन वो आपकी बॉडी को हेल्दी रखता है. बहुत बार ऐसे बिनाइन मतलब नॉन कैंसरस कंडीशन ऐसे होते हैं जिसमें केवल यूट्रस निकाल देने से आपकी जो प्रॉब्लम है वो सॉल्व हो जाती है और ओवरीज निकालने की ज़रूरत नहीं पड़ती है. अगर हम ओवरीज रखते हैं तो आपकी बॉडी एज इट इज़ रहती है, क्योंकि आपके पीरियड जैसे सो कॉल्ड पीरियड जो होते हैं जिसमें आपका एग बन रहा है, आपके हार्मोन्स निकल रहे हैं, वो प्रोसेस आपका बॉडी वैसे ही शुरू रहता है पर आपको ब्लीडिंग नहीं दिखाई देती. दैट्स ऑल. सो यूट्रस निकालना कैन नॉट बी इंडिकेशन उसका सही होना चाहिए, उसका जो वजह होती है वो सही होनी चाहिए, और केवल यूट्रस निकाल देने से बॉडी में कोई साइड इफ़ेक्ट्स नहीं होते. अभी तो बहुत सारे तरीके हैं यूट्रस निकालने के, चाहे हम उसको लैप्रोस्कोपी से निकालें या रोबोट असिस्टेड से निकालें, या एक नो स्कार सर्जरी भी होती है, इट इज़ कॉल्ड एज वी नोट्स सर्जरी, जिसमें हम लैप्रोस्कोपी यूज़ करते हैं थ्रू द वजाइना. सो दिस इज़ कॉल्ड वी नोट्स और वजाइनल नेचुरल ओरोफाइस ट्रांस एंडोस्कोपिक सर्जरी. तो जिसमें हम वजाइना के थ्रू एक पर्टिकुलर पोर्ट डालकर वी पुट आर टेलीस्कोप एंड आर इंस्ट्रूमेंट्स फ्रॉम द वजाइना, और हम यूट्रस को वहाँ पे अंडर विजन देखकर निकालते हैं. तो जैसे ट्रेडिशनल वजाइनल हिस्टेरेक्टमी नहीं थी, उसके अलावा ये लैप्रोस्कोपी थ्रू द वजाइना है, नो स्कार सर्जरी होती है. सो देयर आर लॉट ऑफ वेज ऑफ डूइंग दिस सर्जरी. इसका आउटकम अच्छा होता है, इसका रिकवरी भी आजकल जल्दी हो जाती है. तो अगर डिजीज है ऑर्गन तो नेचुरली उसको हमको ट्रीट तो करना पड़ेगा. सो हमें वी शुड कंसिडर इट एज प्रॉब्लमेटिक एज प्रॉबेबली हैविंग अ कैंसर. सो सपोजिंग अगर आपको कोई कैंसर हो कोई ऑर्गन में, तो आप ऐसा तो नहीं बोलेंगे कि नहीं मुझे नहीं निकालना है मेरा ऑर्गन, यू नो, क्योंकि ऑर्गन निकाल देंगे तो क्या हो जाएगा मेरा. बट अगर वो ऑर्गन आपको तकलीफ दे रहा है तो आपको ट्रीट तो करना ही पड़ेगा. इट्स द सेम थिंग इज़ दैट इट जस्ट बेसिकली बॉइल्स डाउन टू सेइंग कि पेशेंट को हैवी ब्लीडिंग हो रही है बट हमको यूट्रस नहीं निकालना है, चाहे उसको इतनी ब्लीडिंग हो रही है कि वो घर से बाहर नहीं जा सकती, उसको मेडिकेशन लेनी पड़ रही है और उसका हीमोग्लोबिन डाउन हो रहा है, पर यूट्रस नहीं निकालना है. वाई क्यों, मतलब अगर कैंसर होता तो आप निकाल ही देते ना. तो वाई शुड द पेशेंट बी अलाउड टू सफ़र, उसको इतनी तकलीफ क्यों देना है. वाई डोंट वी लेट देम टेक द चॉइस ऑफ टेकिंग एन सोल्यूशन और अ सोल्यूशन टू द प्रॉब्लम. उनको सफ़र करने हम क्यों देते हैं. आई डोंट, दैट doesn't make any sense.
Today I'm turning 50.
Oh,
very close to 50.
right.
And when I was 40, I started experiencing heavy bleeding, very heavy bleeding, and I was diagnosed with adenomyosis. तो उस टाइम पे मुझे डॉक्टर ने बोला था कि आप अपना यूट्रस निकलवा लो, बिकॉज ये बहुत ज़्यादा आपका ब्लड लॉस कर रहा है, और सेकेंडली आप बहुत एनीमिक हो गए हो उसकी वजह से. बट वो जो एक पुराना मिथ होता था ना कि नहीं, हाउ कैन यू पार्ट विथ योर यूट्रस, और फिर क्या हो जाएगा, आई विल नो लॉन्गर बी अ वुमन, वो एक माइंडसेट पहले होता था. बट देन आई ऑल्सो रियलाइज्ड कि मैं कितनी रिस्ट्रिक्टेड हो गई हूँ, बिकॉज आई कांट स्टेप आउट ऑफ द हाउस. आई गेट पीरियड्स फॉर 7 days, एक्सटेंसिव ब्लीडिंग. उससे पहले PMS होता है जिसमें ऑलरेडी मेरे मूड स्विंग्स हो रहे थे. उसके बाद मुझे सिर्फ 10 days का विंडो मिलता है जब आई कैन टेक अ ब्रीदर, फिर से PMS स्टार्ट होता है, फिर ब्लीडिंग होती है. तो देन इट इज़ ओनली दोज 10 days where I can actually function.
Yeah.
Apart from that, I can't function.
True.
And then I finally took a call. I got my hysterectomy done, and believe me, life has changed. Life has changed for the better.
True.
मतलब मुझे ऐसा लगता है कि मैंने ये पहले ले लिया होता स्टेप couple of years back, तो मैं वो टाइम इतना सेव कर पाती अपनी लाइफ में. आई फेल्ट, इनफैक्ट मुझे अब लगता है कि मैं इतनी हेल्दी हो गई हूँ. माई ब्लड लॉस हैज़ कम्प्लीटली गॉन. आई फील मच मोर लाइवलियर नाउ. आई एम एबल टू गो टू द जिम, मैं जो पहले बिल्कुल नहीं कर पाती थी. वर्कआउट्स, जिम, बहुत सारी चीज़ें मैं लाइफ में कर पाती हूँ. बहुत सारी चीज़ें मैंने अकॉम्प्लिश कर ली हैं आफ्टर माई हिस्टेरेक्टमी. सो आई थिंक ये जो इतना बड़ा मिथ होता है ना कि मुझे मेरा बॉडी पार्ट्स को इतना संभाल के रखना है ताकि वो सड़ भी जाए तो भी मुझे कोई फ़र्क नहीं पड़ता, लेकिन सब कुछ अंदर रखो. And my doctor actually at that point of time told me कि अगर ये इस time पे नहीं निकाला होता, you would have got cancer.
Yeah, correct.
So the uterus was in such a bad state.
Yeah.
So I think it's just a myth that people have and that facade. और जो पुराने लोग कहते हैं कि भाई बच्चेदानी नहीं निकालनी है, तुम फिर औरत नहीं रहोगी और तुम्हारे को वेट गेन हो जाएगा, तुम अगली हो जाओगी. I think this is all a myth. People need to get out of it.
That's true.
Absolutely. So how does hysterectomy impact people's life? So for example, अगर ये सिर्फ hysterectomy है, only uterus removal, वो तो आपने बता दिया, but then once the ovaries are also out, does that make any impact
Very
on
big
people's
impact because that
health?
means you become suddenly menopausal.
Okay.
So जो estrogen आपके ovary से आ रहा था, it's completely gone now. So instead of having that perimenopause period we spoke about, which was 2-3 years,
Yeah.
you are suddenly one day having estrogen, next day not having any estrogen. So the body goes through a sudden shock. So there are a lot of implications wherein some patients develop extreme amount of hot flushes, they are unable to sleep, they get tired very quickly, their body takes almost 6 months to adjust and get back. So sometimes some people gain a lot of weight because of it. Again, these are changes which can be managed. So the impact of the menopause is as bad as how you, as a patient, you're looking after yourself. Actually, that's what I tell my patients. So if you are, you know कि आपके problem है and आपको uterus and ovaries दोनों निकालने की ज़रूरत पड़ रही है, तो इसके बाद a discussion pre-surgery to have with the patient to say कि see, you will go through these changes. And at that point of time, you should be aware that you are committing to yourself कि आप अपने बारे में इतनी सारी चीज़ें care लोगे. So, you know, you commit yourself to eating healthy, commit yourself to doing good amount of exercise, take your supplements correctly. You know, slowly over a period of time, you will become normal again. So it's possible to manage the symptoms, but at the same time, patient has to be educated very well pre-surgery कि this is what the impact is going to be, and आपको अपने आप को संभालना पड़ेगा इसमें. तो वो एक it's a big thing, you know, for a woman to go through a hysterectomy, a uterus removal. The whole body changes a lot because, like you rightly said, not being a woman. So I wouldn't say you're not a woman anymore, but a very big part of what a woman is in terms of estrogen and progesterone hormone is not there with you. So it does impact your system quite a bit, you know. So preparing yourself before your surgery to make sure that you know how you are going to set your next 6 months is very, very important.
So what can be expected?
So it's like weight gain, hot flushes, not able to sleep, arthritis, feeling tired all the time.
After the surgery?
After the surgery, yes. So, I mean, in maybe a month or so, suddenly you start feeling all these things. Emotional issues can become a big issue. So that's where all your supplements come into play. So, you know, when you start feeling these symptoms, you should start your supplements correctly on time. Sometimes some patients experience extreme amount of symptoms which require hormone replacement therapy also, which is essentially a synthetic hormone which is replacing what your estrogen from the ovary was coming. So that of course will depend on whether you are fit enough to get to take HRT or not. So there are a lot of criteria as to whether you can or cannot take HRT, but that is another option the patient can opt for.
In fact, I want to ask you this, that what is HRT? I am taking HRT right now with you. According to me, HRT is something which should be done for a lot of women who are in a situation where they have lost estrogen in their body. But what exactly is HRT according to you, and who should take it?
So HRT essentially is replacing estrogen which our body was naturally producing through ovaries with the help of a conjugated estrogen, which is an artificial estrogen you're taking. You are needing estrogen for certain very basic things that are there. One is specifically for your bone health. So a lot of people who develop osteoporosis, where the estrogen was the main driver, जो आपके calcium को हड्डियों में डालता है, it puts the calcium back in your bones. So if you are experiencing bone loss and you're experiencing osteopenia, osteoporosis, estrogen therapy is one of the things that are recommended for them. If you are losing your cognitive function, so not able to function normally, not able to remember things, not able to do routine activities. Some people who are in a very high pressure job, for them that cognitive function of being able to think on the spot and not be in a fog, brain fog all the time is very important. For them again, estrogen makes a very big difference. HRT is very much required for them. Somebody who's also experienced extreme amount of hot flushes. So ये भी एक vascular complication होता है जहाँ पे the hot flushes are so much that bete suddenly you are suddenly all red and you are profusely sweating in the middle of where everybody else is normal. You're going in a meeting and you start having a hot flush. So these are again indications where HRT लेने की ज़रूरत पड़ती है आपको. Also, in patients sometimes who have a lot of genitourinary symptoms. So some people may have atrophic vagina, which is very painful, leading to a very painful intercourse, or loss of libido, or not able to control urine, having a very overactive bladder. So these are genitourinary symptoms of menopause. Again, here HRT and local application of estrogen is required for these patients. So that's where HRT is recommended for them.
And how does the HRT come into the body? What happens to
the HRT basically is a tablet or a gel or a patch. There are 3 types that are available. So you can either take a single tablet every day. Specifically, if आपको uterus नहीं है, तो it makes it easier because only one estrogen is required. If you have a uterus, you have to take 2 hormones, estrogen and progesterone. So they come in a combination pill that you can take, or 2 different pills. You can also use it as a gel, which is applied on the skin. It's absorbed. Only thing is the absorption can be a little variable, तो level of hormone थोड़ा up and down हो सकता है उसमें. There is a patch also which is available, which can be applied on the skin. It stays on for about a week, and it transdermal application होता है estrogen का. Basically, it takes away that need of taking a pill every day. So these are the ways of using it. There is a gel available to apply in the vagina as well. That also can be used.
And what is the longevity of this HRT? The whole procedure of HRT, उसका क्या longevity
there is actually there is no such thing as a limit to it, frankly. But generally we would want to give it to ladies definitely up to 55 years of age, after which we can take a call of slowly reducing the level of HRT and slowly phasing the HRT out. However, there are some women who have been on it as long as they are well monitored, as long as they are well, because there are certain risk factors associated with HRT. For example, more than 5 years of use can subject you to developing blood clots in your veins. You may develop hypertension as well. And more than 10 years of use may increase your breast cancer risk. So you have to be under surveillance. You have to be monitored with all your blood reports, mammography, ultrasounds very, very regularly while you're on HRT. So we know of people who would want to continue HRT even up to 60, 65 years of age. But on an average, I would say up to 55 and then phase it out.
Yes. So doc, when one administers HRT, in a patient, can this patient lead a normal life like how she used to be before menopause?
Yeah, it's like magic. You just get back to what you were before. So you start feeling normal again. Yeah, absolutely. Because it's just the level of estrogen, though, may not be as high as what your ovary was producing, but it's good enough to get you back on your feet, back to normal exercise regimen, your brain activity, your sharpness, your memory, everything just comes back. Your weight control comes back.
Yeah, and I think I'm also witnessing a lot of change after I've started with the HRT, because a lot of these aches and pains which had started, they've all gone completely.
True.
So at one point I was thinking of going to an orthopedic for these kind of issues, but I think now they've all completely eliminated.
That's true.
How often should one go for screenings, even in a regular routine practice? So without any red flag, what is the routine that one needs to follow in terms of screening?
So we'll start with the beginning. Say if you were someone who was young and less than 25, 30 years of age, I think the first thing that you should do when you started your periods, is to consider getting a cervical cancer vaccine done. Very important, because that is a very safe vaccine available now to fight against HPV virus, which women get when they have intercourse. And if the virus stays in your body system for more than 10 years, it can cause cervical cancer. So taking the vaccine is like arming your body's immune system up with immunoglobulins, which will act against the virus and not allow the virus to grow in your system. So when you're in a younger age, getting your vaccine done is very, very important. Getting a checkup done initially when your periods start to ensure that you are, everything is okay, your your hemoglobin is fine and your periods are regular, everything is good, there's no PCOD and all of it. Once you become sexually active, getting your pap smears done is very important once in 3 years. Even if you've taken the vaccine, does not mean that you don't do the pap smear, because vaccine is giving you an immunity, but it's not that you don't screen yourself to look for whether you developed an infection or not, because that will just make you more aware and vigilant about getting your pap smears done regularly. So, I mean, or checking yourself more regularly about it. So that's pap smears. Any abnormalities in your period cycle, when you're less than 30 years of age, a regular ultrasound can also be done, maybe say once in 5 years or so. Once you've crossed 30 years of age, I think a yearly exam to check your sugars, cholesterol, thyroid is important. A self-breast examination is important. And maybe once in 3 years or so, or 4 years, just getting an ultrasound will be a very good idea. Once you cross 40, mammography becomes mandatory. At least if you have a family history of breast cancer, then every year. Otherwise, at least once in 2 years, at least you would have to get it done. Ultrasound also similarly once in 2 years. But your bloods you must do regularly, because that's where your eye can change. You can change your number. You can develop blood pressure issues. You can develop diabetes. You can develop cholesterol. So getting all your blood checks done, getting your ultrasound done, getting your mammography done is very important. Pap smear continues till you have crossed 55, which is menopause age. Once you've hit menopause, that's when checking your bone health is also important. So that's where the checkup becomes more regular, in the sense every year almost you are getting everything checked, because your risk of ovarian cancer and the risk of cervical cancer, breast cancer is maximum after 55 years of age. So, mammos are more frequent, ultrasounds are more frequent every year, and blood checks are done every year as you were doing previous to this. There are a group of people who are above 75 years of age. Now, there's one thing very peculiar which I think I must talk to you about, is कि इनमें itching की problem शुरू होती है 75-year-olds, and generally 75-year-olds are very shy to get themselves checked by a gynecologist or even tell anybody in the family कि उनको genital area में itching हो रही है. They don't want to speak about it, okay? And generally they will go to their local doctor or maybe even the chemist sometimes. And वो उनको एक एंटी फंगल क्रीम दे दिया जाएगा कि just put that, must be fungal infection. It is a very subtle sign of vulval cancer, which generally comes to these women after 75, very often ignored, and very often because there has been no examination, because she was too shy to get it checked, will actually come up in an advanced stage by the time that big mass grows up, and then the whole course of doing a surgery for that particular cancer and radiation is very messy. So an elderly woman who's having intense itching in the vulva, not relieved on these local antifungals, must get a review done with a gynecologist. Very important.
That's something which I've never heard before, and this is an insight that you just shared with me, and thank you. I think a lot of elderly women ignore their issues, and I've not even heard, to be very honest, that they also have gynec issues or issues related to their health, and this is absolutely insightful.
Sure.
So, Doc, how does physical health influence the overall well-being and self-perception of a person?
Of course, if you're feeling healthy, if you are able to get up from a chair without having a pain in your knees or your back, and you are able to get on with your routine activities, never mind if your period has come or not come, just makes you feel empowered enough to do whatever you need to do. You don't need to plan and think if I'm getting my periods, then I can't plan my holiday at that point of time, or I can't do that business meeting at that point of time because I'm having periods. What if I have a very heavy flow and I have a problem there, or wear a certain color of clothes only at that point of time? So if you don't have to think your routine around your reproductive health or your general health, naturally your confidence is going to be much better. Your issues of anxiety, depression, those things just go down on their own. So keeping your general regular checkups done and making sure that you are in a healthy way and taking care of those minor things that may be coming up, it makes a lot of sense. Women who are 45 years plus often have SUI, stress urinary incontinence. Again, something people don't talk about. So the moment they cough, laugh or sneeze, there'll be a small leak of urine that will happen.
Oh.
So they will compensate by putting a panty liner or keeping tissue paper there, or even sometimes using a pad when they're going, so that they don't spoil their clothes. But they don't want to seek treatment or help for it. So that is again something that they think it's okay, thoda bahut hota hai, I'll manage this. But I think you should, why would you want to live in a compromised situation? You shouldn't do it. You should just get yourself checked. There are exercises available, there are creams available that can be given to you to help do that. Yeah, to take care of mild SUI.
One out of the box question, that why would a woman not seek medical help?
Because she's told by her family members, her grandmother or her mother tells us कि ये तो होता रहता है ना. I mean, when you थोड़ा बहुत तो urine का leak will happen to you when you grow older.
In general also.
When you become menopausal, उसके time पर heavy bleeding तो normal है. ऐसा ही menopause होता है. See, there are so many myths which are surrounding them. Grandmothers have not gone to their doctors to get checkups done. Mothers have not gone there. So they're teaching the daughters the same thing. So it's like you don't necessarily have to look at this as a problem. You know, you just tolerate it. Tolerant. Women is a very tolerant person. That's like a badge of honor that people...
Devi.
Yeah. It's a badge of honor that they, hang around with to say, ki boss, abhi ko kuch nahi hota hai. So we are taught not to complain much. Absolutely.
And I think a lot of things rotate around how much do you care about yourself. Yeah. It's all about self-love. Yeah. If I am very cautious about my health, my well-being, it's not just about being selfish. It's about a responsibility that I have towards me.
True.
Because if my cup is not full, how can I fill someone else's cup?
Absolutely.
So if I have children to take care, if I have a husband to look after, if I have a whole family to manage, if I have work to take care of, I think I also better be in the best state of mind, and not just mind, but for best state of body as well. So I think it's everybody's responsibility to look after themselves first.
True. Women should think about themselves as well. I mean, the tradition has been to look after everybody else, but when it comes to their own doctor's appointment, if it comes up with something else happening with your son or your daughter, you don't want to do that. And, you want to prioritize that as compared to going to your own doctor for your checkup. You'd want to do that because, ठीक है, मेरा तो होता रहेगा, like, let's look after it because I'm responsible for my child. But then you're forgetting that if you have ignored something in your own health, in the long run, you are not going to be able to give 100% to whatever is happening around of you.
I think when we keep talking about self-respect first comes by respecting your own self. I think the definition needs to be very clear to people, that respect yourself first.
Correct.
Address all your issues first, because everything starts from you.
So, it's in Indian culture, when you talk too much about yourself, and you say you are like this, you are this, I am this, I am this, I am this. So the tradition is to say, leave the I behind, and be somebody who's looking after everybody else. You look after everybody else. You become a part of the family. That's when you will be taken care of. That's the general way we are taught to be. So women need to understand that taking care of themselves, self-care, is not being selfish. Two very different things, okay? So if you say that, no, I cannot attend this particular school function because I have a doctor's appointment, it's important for me to go there, and you get someone else to fill in for you, it's not being selfish. It's not like you're being a bad person, that you're not doing this for the child, but it is looking after yourself so that you can do better for them. So I think that concept or the mindset has to change to say self-care is not selfish. It's not being selfish, not at all.
And I think if you need to bring your house in order, you have to be in order first.
Absolutely.
Because if you are messy and if you are so chaotic in your own head, in your own body, true, I don't think that you are in a position to take care of anything in any case.
Yeah, but it takes a lot of learning for women to do that. I mean, I would say...
I've learned it the hard way.
Exactly. I mean, even for me, I would say that it's been a long, long journey to actually understand that, no, it's me. I have to look after myself first before I can say that, yes, I'm okay to look after anybody else.
Absolutely. Yeah. Absolutely. So we have a last question, and this is the breaking the mirror section.
Okay.
And the question is that what is that one myth about gynecological health that you want to break? The myth around this term that you want to break today.
About gynecological health, that you should be able to go on with your routine activities along with your period cycle. Your period cycle should not come in the way of your routine activities. I think that's a myth to say, periods aaya to I should compromise myself and sit down and if I'm having pain, take a medication. But it's okay, that's normal. That's not normal. Period is a very natural part of your body system. You are going through that monthly cycle. You should be able to get on with everything else that you're doing there. And if there is a stop that's coming there, that is preventing you from doing that, then please get yourself checked, because there has to be a problem there. God did not make us to suffer. Why would God give us something which is going to make you be in pain, have issues with bleeding, or feel very less of a person at that particular point of time? Nature is never doing that. Nature doesn't do that to animals. Animals don't go about saying they have period pains and sit down. That doesn't happen to them, right? So nature by itself cannot possibly have given you that. So if you're having an issue with your period which is interfering with you doing your routine activities, then that means there is a problem. Just get yourself checked.
And not self-medicate yourself, which is very, very important. Don't become a doctor of your own self. Go to a professional. Seek help. And I think an early intervention is very, very important.
Absolutely, yeah.
Thank you so much. This was wonderful. And I think a lot of awareness will come through this conversation, and a lot of educational conversation has happened today. And a lot of things which I also did not know have also come in light. So this was really, really amazing. And once again, very, very big thank you to you for these insights. And this was a great conversation.
Thank you so much, Suman. Like your cup says here, that is perception and beyond. So yes, I think breaking the perception and the myths about women's health and going beyond that, and that's what we've achieved today. Thank you so much.
Absolutely. Thank you. Thank you once again. थैंक यू परसेप्शन एंड बियॉन्ड का हिस्सा बनने के लिए. आई होप ये कॉन्वर्सेशन आपको नए इंसाइट्स और एक फ्रेश पर्सपेक्टिव दे पाई. अगर आपको ये एपिसोड पसंद आया तो लाइक, शेयर और सब्सक्राइब ज़रूर करें. और अगर आपको लगता है कि ये किसी और के भी काम आ सकती है तो उनके साथ ज़रूर शेयर करें, क्योंकि सही नॉलेज एक बड़ा ट्रांसफॉर्मेशन ला सकता है. मिलते हैं नेक्स्ट एपिसोड में.